Hi, my name is Joe Johnson, student of physical therapy here at Advent Health University. Today, I'm going to be teaching you guys how to...
Hi, I'm David Baker, a student of physical therapy at Advent Health University, and today I'm going to show you how to navigate stairs with axillary crutches. First off, you want to check your equipment. Make sure there's no wear and tear, and make sure it fits your patient. When fitting your patient, you want to make sure that you have 3 finger widths between the armrest and the axilla of the patient. On top of that, you want to make sure that you have 20 to 30 degrees of elbow flexion when the patient is using the crutches.
A good way to remember how to navigate stairs with crutches is the saying up with the good, down with the bad. So watch here as the therapist instructs the patient to start going up the stairs with their good leg, followed by the affected side and the crutches. Notice how the therapist started on the affected side and is now standing behind the patient, keeping a tight grip on the gait belt, giving physical and verbal cues as needed. Following the saying up with the good, down with the bad, you want to cue your patient to bring the affected side and the crutches down the stairs first, followed by the good side. Notice here that the therapist is now facing the patient, preventing the patient from falling forward, keeping a tight grip on the gait belt, and maintaining good body mechanics as the patient descends the stairs. An important safety precaution when using crutches is to maintain proper posture. Failing to do so can result in increased pressure in your neurovascular structures in your axilla, leading to further injury. Remember to keep your chest up and push through your hands. Axillary crutches can be used singly or bilaterally. When navigating stairs with one crutch, make sure you place the crutch on the good side while holding the railing with the affected side. Bilateral axillary crutches are used to increase your balance and to partially or fully unload a lower limb, transferring body weight through the upper extremities. Axillary crutches allow for increased gait speed and a greater selection of gait patterns rather than walkers. They also permit functional ambulation with restricted weight bearing, but they're less stable than walkers. Some advantages of axillary crutches are that they improve balance and lateral stability and provide for greater functional ambulation while allowing restricted weight bearing. They're very useful for stair climbing. They can be easily adjusted, relatively inexpensive, and easy to store. Some disadvantages is that they're less stable than walkers and require greater upper body and trunk strength for most gait patterns. Because of the broad tripod stance they create, crutches are awkward and potentially more hazardous in smaller crowded areas. Some patients will tend to rest on the padded axillary bars, which can cause damage to the axillary vascular structures, as well as the axillary and radial nerves. With that being said, some indications for axillary crutches is going to be any temporary or permanent condition where the lower extremity balance and weight bearing is compromised with a patient who has sufficient upper body strength and coordination to support and move their own body weight. And on top of that, any musculoskeletal or neurological condition that reduces the mobility, strength, and sensation can potentially be a contraindication to the short-term or long-term use of crutches. And with that, thank you for watching our video on how to navigate stairs with crutches.